Hi, my name's Alexis, and I'm going to go over a couple different pieces of information for IV insertion and then intramuscular injection. So the big thing with intramuscular injection, whenever you are doing the actual injecting portion, you want to make sure that you're going at a 90-degree angle. I have my cute little insulin syringe in my arm I'm going to use to just kind of show that. So you're going to go for a 90-degree angle. The goal here, obviously you won't inject into the arm, we all know that, is to hit the muscle. You're not wanting to hit the fatty tissue or kind of anything between that top layer of skin and that muscle. You want to get directly to that muscle so that the medication can be absorbed. When it comes to injecting intramuscularly, there's a couple different spots you can go, and they do have limits as to how much you can inject into them. So you can use the deltoid on either side, and the max volume there is 1 or 2 mils in a well-developed adult. This typically, while it may be an easy spot to reach if you're trying to do something like sedate a combative patient, 1 to 2 mils isn't going to get you very far. But if it's all you have and you have to do 2 injections, then it's kind of situational dependent on what you have to do to solve the situation that you're in. You can also use the outer thigh here, and that can hold up to 3 mils in an adult and 1 mil in a child. So that's another good kind of easy to get to spot. If you have enough people holding down, say again, a combative patient, you can have them hold them down and just expose the thigh and go ahead and use that for your injection area. You can also do the hip, which is over on the side here. That holds up to 3 to 4 mils. That's a little bit harder to reach and get to in a combative patient, but if you're doing like medication administration for some other reason, then that's perfectly suitable to use. They're used to also allow you to use like the buttocks area. They don't really recommend that anymore. It can hold up to 3 mils, but the problem was you run so much of a risk of hitting the sciatic nerve and causing pain and nerve damage that they don't really recommend that you use that spot anymore. Whenever it comes to IV insertion, you're going to be aiming for the vein. So you're going to want to do like a 10 to 15 degree angle. It's a really small angle. And you're going to want to make sure, as with IM injections and with IVs, that you have the beveled end of the needle up. You should be able to visualize it. Make sure that it's up and pointing up towards the sky so that you get proper insertion and you cause less damage to the patient, less discomfort, and all of that not so fun stuff. However, with IV insertion and use, there are a couple things that can happen. You can have infiltration of the medication through your IV. So basically that's when the medication leaks out of the vein and into the tissue surrounding the IV insertion site. This is uncomfortable for the patient. You'll see things like swelling, sometimes blistering if it's really bad. Just uncomfortable. No one really likes that. You can also irritate the vein. So this can come from something like the toxicity of the medication that you're using. Some medications are more toxic to veins than others, or it could also be from using the wrong size or type of catheter for that location. It's always important to pick the best size for the location that you're aiming. Obviously, you're not going to want to put like an 18 gauge in the hand. The hand veins are small. They're not really going to hold that well. If you happen to get it in there, it will likely cause vein irritation. There can also happen, you can also get an occlusion. So this occurs when the catheter becomes blocked by a blood clot inside the patient's vein. Not really much you can do there. Sometimes you can try and flush it past, but a lot of the times you end up having to remove that IV and start a new one. One of the big things that can happen and becomes a big issue is an air embolism. So this happens when too much air enters the bloodstream through either through a flush or through the IV bag or something of that nature, and it blocks blood flow to other organs like the lungs or the brain. Obviously that's bad. A couple bubbles isn't going to cause an air embolism, but you start getting several mils of air in there, and then it can cause a bigger issue. So we want to make sure that when we're pushing medications or we're doing our flushes, that we get all the air out of the flush or the medication prior to administering it. You can also get a hematoma around the site. This is just when blood leaks from the punctured vein and accumulates under the skin at the insertion site. Looks like a big bruise. It's very uncomfortable for the patient. Pretty easy to see. Again, just a side effect of using either like improper size of cannula or the wrong type of cannula for that location. Another thing that can happen that we won't really see so much in the EMS world, but more so in the hospital world because it takes a little bit to develop, is thrombophlebitis. So this happens when the vein becomes inflamed due to a blood clot forming around the catheter or from the catheter irritating the vein. This, again, can be caused by the wrong catheter size and type. So the biggest thing to pull back from that is to make sure that you're using the proper size catheter for the location, you have a good insertion technique, and you are using the right type of catheter for what you're trying to accomplish.